name is Jason Shutt. I'm here with Duke Rehab to Performance. Just want to go through some of the common things that we see with a hip flexor stretch and then how we can correct that. So often when we get somebody into a half kneeling hip flexor stretch, we'll see this. And they'll really not verbalize that they're getting a lot of anterior hip stretch, but they'll notice a lot more low back discomfort. Well, that's because we're really not stretching the hip at all, but we're just using a lot of lumbar flexion. So the correction to this is to actually get them beginning in tall kneeling and get them to become aware of pelvis positioning. So I'm just going to have Scott go through some anterior and posterior pelvic tilts to learn how to level the pelvis off before he begins the hip flexor stretch. So once he's got a nice level pelvis, good, we can step into half kneeling. And from this position now, we can really focus on pushing the hip forward and using a glute contraction to force the hip flexor to reciprocally relax, and we get a nice stretch there. If you've got a client who is struggling with balance here, we can give them assistance. They can actually drive that into the ground to give them a little bit of core stability, and then push into the stretch and feel that along the anterior part of the hip. And that's a good fix for the common hip flexor stretch.